Good day. My name is Kanzi and I am going to answer the question, is COVID third wave inevitable? In order to do so, let's first see the past pandemics. In particular, the 1918 pandemic, also known as the Spanish flu, caused by the H1N1 virus with the genes of alien origin. I've taken this pandemic for two reasons. Number one is the similarities between H1N1 and COVID. It has a similar disease presentation. They both cause respiratory diseases. Both viruses are transmitted by droplets or contact or through fomites, and as a result have the same public health measures such as hand hygiene and respiratory etiquette like the use of masks. The second reason is the availability of data of the 1918 pandemic compared to the other pandemics which were widespread. It is estimated that it affected 500 million people worldwide, that is one third of the world's population, killing at least 50 million people in the span of 1 to 2 years. If we look at the graph of how it progressed, you can see the first wave is smaller, and then a massive increase in second wave, continued by a small third wave. Interestingly, when we compare it to the current graph of India, it has a similar smaller first wave and a massive increase in second wave, which is ongoing right now. So if it takes the same course, there will be a third wave. But a lot has changed. We have a vaccine right now, and there are advances in healthcare and more awareness and knowledge of how the disease works. So let's look at the current pandemic itself. As you can see here, these graphs show the new cases in various countries, and there's a variety of presentation, a lot of them having more than two waves. So I did an analysis of the topmost 12 infected countries and found out that 10 out of those 12 countries already have the third wave, and 7 out of those 12 countries have more than 3 waves. Since population is also an important factor in the progression of waves, I also analyzed the top 10 most populous countries, and 6 out of those 10 countries have a third wave or even more, in spite of these vaccinations. All these point towards an upcoming third wave in India. So what are the measures to be taken? We follow the guidelines by the Control of Disease Center and the World Health Organization, like social distancing, hand hygiene, and we also follow the government policies such as the lockdown and vaccination. While I was researching about this, the term black fungus popped up a lot. Black fungus is a layman's term for mucormycosis. It doesn't affect healthy individuals, but there are some conducive factors. Glucose, an acidic environment, patients with diabetes and acidosis, and impaired immunity, the use of steroids during this COVID treatment is a risk factor. And the use of antibiotics have reduced the common cells which prevent the growth of the fungus. Due to large-scale use of oxygen masks, it leads to moisture accumulation, which in turn leads to disease. But it is no way related particularly to the third wave or directly linked to the virus itself. Data shows out of almost 3 crores of COVID cases, roughly 30,000 people have been affected by mucormycosis, which is 0.096%, but the media has blown it out of proportion. And it is not as alarming as it portrays, but it is safe to keep an eye out for it by recognizing signs like swelling, facial pain, or color discharge early. So, in summary, based on how the past pandemics have worked and looking at the current pandemic and how it is progressing, I conclude that the third wave of COVID in India is inevitable, and also the black fungus is not part of the third wave. Thank you for watching. Stay safe.